Right, so this video is for the Lachman's test, which tests the integrity of the ACL ligament, the anterior cruciate ligament. So what we're trying to show the kids in class is how to do this test properly. It can be difficult depending upon the athlete's size of their leg, especially if you got small hands. But it's a pretty accurate test if you know how to do it correctly. So one hand is going to go above the patella here, kind of, on the femur bone where you're grabbing the quadricep muscle. One hand here, and then the other hand down here below on the tibia, where we're just below like that tibia tuberosity. And basically what we're trying to do is we're trying to do this type of translation, which means then pulling the tibia forward on a fixed femur. And so the ACL, what it does, it prevents the tibia from going forward on a fixed femur. So what you want to do is you're going to have the athlete relax. I always tell them to kind of like relax at the hip, and I kind of bring the leg like this a little bit to see if they are relaxed, get myself set up. And then it's this type of movement. And what we're going to do is the leg should be lifted at about 15 to 20 degrees of flexion, and then we're trying to pull the tibia forward. Now, I know my athlete right here feels it because he's got a normal ACL, that there's this total like solid clunk. When I go ahead and pull, I'm like, his knee just stops abruptly. And that's good, because then that tells you that the ACL is not injured. It's when you do that test and you get like a very spongy feeling or an excessive amount of translation forward on that tibia, that's a positive test for a torn ACL. Always when you do that, compare one side to the other and make sure you get a good history so you know what you're dealing with. Okay, cool.